Madam Speaker, I request that all first responders join me in the well.
Representative Favors, you're recognized.
Madam Speaker, I move passage of House Bill number 306 on third and final consideration.
Representative Favors moves passage, properly seconded. Mr. Clerk, call the First Amendment.
House Criminal Justice Committee Amendment 1 spread on the member's desk.
Chairman Watson, you're recognized.
Thank you, Madam Speaker. This amendment redefines health care provider. Madam Speaker, I move to adopt House Criminal Justice Committee Amendment number 1. And
Chairman Watson moves adoption of Amendment number 1, properly seconded. Discussion on the amendment. All those in favor of Amendment number 1 say aye. Those opposed say no. You adopt. Next amendment.
No further amendments, Madam Speaker.
Representative Favors, you're recognized.
Madam Speaker, with that explanation, I move passage of House Bill number 306.
Representative Favors renews her motion. Discussion on the bill. Representative Lynn.
Thank you, Madam Speaker. Will the sponsor yield?
The Speaker yields.
I have great respect for the people that you're trying to protect with this bill. I truly do. If you remember, this bill has been before us before a few years ago, and we did end up killing this bill because what this bill is seeking to do in the law is to create a special protected class of people so that if somebody was hurt in the performance of their duty, it would be a greater penalty than if anybody else was hurt in the performance of their job. Now, we have special protected classes in the United States, and it's usually limited to race, color, religion, national origin, gender. But we don't single out people just because of their occupation as a special protected class. And members, please listen to me. This is a slippery slope. We do not want to single out people by their occupation for greater punishment if somebody hurts them, greater punishment than you at your job or your neighbor at their job. That is the slippery slope. It is not a good idea. Where do we stop? We have the United States Constitution. We have the Civil Rights Act to protect people. Do we want to, they used to pass laws. They used to pass laws saying that some people are more valuable than others, and the law wouldn't protect certain people because of their race or their gender. And we stopped that because that is wrong. You can't help your race. You can't help your gender. You can't help your national origin. You can't. But this is singling out people just because they have a certain occupation for greater protection under the law than everybody else. And I hope you realize that this is a slippery slope. Who will be here next asking for the law to protect them greater than everybody else? Who will be here next? Just imagine. I am going to vote against your legislation. I truly respect the people who work in the occupations that you are trying to protect, but I also believe that everybody deserves equal protection under the law, and that is what our country is about. Thank you.
Thank you, my colleague.
Representative Dennis, did you seek recognition?
Thank you, Madam Speaker. Will the sponsor yield?
The sponsor yields.
What is the purpose again for this bill? What's the purpose for this bill? Why is this
the purpose of this bill, Representative Dennis and my colleagues, is that there has been such a high incidence of workplace in the healthcare place that about 27 states are in various stages of discussions regarding a similar bill. And because a bill was passed that did provide special protection for law enforcement officers, also for transportation workers who work on the interstate, it was felt that this would increase the severity of the penalty so that it would diminish the violence in the workplace. It has increased significantly. I think the last statistics that I did see, it was about 40% of an increase in recent years. And yes, it has been introduced in the past and was not successfully passed. However, because it is a tremendous increase, it is believed that it would help to diminish that. There are many nurses, doctors, nursing assistants, many others who now are reluctant to work in certain places like emergency rooms, and we all have classes and training in conflict resolution. So it's not going to be a situation where you won't evaluate the person who is being violent in the workplace. We have such a tremendous number of people who use substance abuse, who are substance abusers, and they come to the facilities where these drugs are kept. And many times they come with weapons, and sometimes they come with other issues that create a situation of hostility and violence in the workplace. That is the purpose for this. I would not be one who would be wanting to separate out any categories of workers. But in this situation, especially when you have such an increased demand for healthcare workers, we believe that this would help to circumvent and diminish some of the violence that we are experiencing in the workplace throughout this entire nation, not just in Tennessee. As I said, there are about 27 other states that are in varying stages of legislation.
So as I understand it, this bill raises the maximum fines. The maximum fine. This bill raises the maximum fines if an assault or an aggravated assault is committed against one of the members of the protected class in your bill.
That is correct.
Okay. Can you tell me the difference between the maximum fine for most normal Class B misdemeanors as opposed to, say, Class D felonies?
Well, I do not know that information, sir. I'm not an attorney, and I haven't looked at that information. However, the judges, from what I understand, judges can fine the person up to that amount. It would be up to the judiciary system as to how they would be fined, but they would understand that they could be fined an increased amount of what it is today.
Your answer to the question is the exact reason that I can't support your bill. If the sponsor of this legislation, and that's, my guess is most of the members in the well behind you, don't know what the current maximum penalty is for an aggravated assault or a simple assault, I'm pretty well sure from common sense and my experience in doing criminal work, nobody in the public does either. So if we're going to do something that actually has a deterrent effect on criminal conduct, this doesn't do it, in my opinion, because nobody knows now in the general public, the defendants that are out there, what the maximum penalty is for a simple assault or for an aggravated assault. They're not going to know now that we have increased it by whatever amount we're increasing it by. This doesn't, in my opinion, do anything to deter conduct, because no one in the general public of the increased crime rate that you testified about, none of those people that committed those crimes knew I may be facing a $5,000 fine instead of a $2,500 fine as a maximum penalty. Wait, I better not do that. They don't know that. It doesn't work that way. The criminal justice system doesn't work that way. I appreciate the intent of the bill. I appreciate trying to protect individuals, but I have two major objections. One is creating a protected class, because I'm just as apt to get shot when I walk outside of a courtroom after I've torn up the other side in a divorce case as anybody else. But that doesn't mean I'm the protected class, and it's worse when they shoot me as anybody else. It's probably less, knowing my profession. But we don't need to create protected classes, and the bottom line is this won't do anything to stop criminal conduct, because they don't know. They don't know what the fine is. They don't know what the penalty is. We try to punish as best we can. This won't deter because they don't know. But appreciate the intent. Just can't support as it is. Thank you.
Representative Stewart. Representative Favors, did you?
I certainly appreciate your comments, and it does, I can understand the rationale that you present. However, we spend much time here in this General Assembly increasing the severity of penalties and fines on a frequent basis. So if that is the rationale that you are presenting, then we probably need to go back and reconsider our efforts on some of the other bills that we have passed in this General Assembly.
Representative Stewart.
Yes, will the sponsor yield?
The sponsor yields.
Maybe I'm misunderstanding the bill because it doesn't seem that complicated. It looks to me like this doesn't increase the penalties for all health care providers. It increases the penalties for a health care provider acting in the discharge of the provider's duty. Am I reading that right?
That is correct.
So it looks to me like if I'm a nurse or a paramedic or an operating room physician, it's when I've got the scalpel in my hand that this bill creates an increased penalty. What it says to me is if I jump up while I'm getting treated and I choose to go after the physician or the nurse that's trying to treat me in the middle of a hospital room full of all sorts of chemicals and sophisticated equipment and potentially other patients, then I'm going to face a heightened penalty, right? I mean, isn't that what this goes to?
That is the intent.
See, what I'm curious about, I don't understand the whole idea of this protected class argument. It doesn't make any sense to me, and here's why. We have many laws on our books right now, don't we, where if a police officer is coming at, is coming down the street and I choose to attack that police officer, if he's wearing a uniform or has identified himself, if I get in a fight with him, that's a big difference than if I get in a fight with some guy at a bar who turns out to be a police officer off duty. And the reason is because someone who is carrying out our laws, who is protecting the public, has a whole different level of focus. That person is armed. That person is out there protecting the public at large. To me, it seems very similar to a surgeon who is performing an operation. It's a different person. We're not saying that any surgeon just sitting in a bar room gets extra protection, right? We're just saying the surgeon, while he's standing there in the operating room, gets this protection. To me, it seems like it's exactly like a police officer in the course of his duty, or, for example, a pilot or a flight attendant in the course of their duty. As we all know, pilots and flight attendant, assaulting a flight attendant or a pilot on an aircraft is a federal felony with no underlying misdemeanor. Now, if you assault that same pilot or flight attendant on a golf course because you're angry about a slice, that's a problem, but that's a different level of focus because that pilot or flight attendant's not up at 30,000 feet protecting all these other people. Seems to me the reason that you're creating the protected class here is we can't have health care providers under a fearful environment when they are performing life and death decisions, just as we can't have a police officer walking down the street faced with some clown trying to get in their way. It's a whole different heightened level of responsibility because we're relying on the police officer to protect the public. We're relying on the pilot, the flight attendant to keep that plane in the air. We're relying on the person in the hospital, the healthcare provider that you're trying to protect somebody. Seems to me this is a very common sense bill. If one of my relatives is in a hospital bed next to the person that's being treated, I don't want those nurses and doctors interfered with by some clown who decides to get up and cause trouble. And I think all people in our society, just as they know you shouldn't get up and punch a flight attendant, you shouldn't get up and punch a police officer, they all know you shouldn't get up and punch a healthcare provider. So I just don't see that this could really be a problem in terms of people not knowing that they're going to be subject to a penalty. Anyway, I think it's a great bill. Don't you think that it's very analogous? I mean, it seems like what you're trying to say is that these people deserve special protection because they have special responsibilities.
Yes,
am I right?
That is correct.
Thank you. This is a great bill, and I appreciate it.
Thank you.
Representative Joe Carr.
Thank you, Madam Speaker. Will the sponsor yield?
The sponsor yields.
I think that was an excellent dialogue and it answered several of my questions, but I want to make sure I did understand one thing correctly. You're creating a special class of people by virtue of the law for those penalties when they're dispensing those duties, correct? And and to the benefit of the public. Is that right?
That's correct.
So when a doctor or a nurse or an EMT or a firefighter is assaulted in the course of executing their duties, there is a special penalty associated with that assault. Is that right?
That is correct.
My question is, and my colleague from Davidson County said used the term a public servant in identifying them. My question to you is if it's predicated, if a special assault or special penalty is predicated on an individual who's in the role of a public servant executing those public servant duties, why are you confining it to just the medical health care profession? He used the example of an airline pilot and an airline steward. They're certainly not public servants, but they act in the public sector, and if they're assaulted, apparently according to the law, it's a felony. My question to you, based on his argument, would you not extend it to a taxi cab driver?
I am certain you could extend that, Representative, to any category of workers that you would feel the need to do so, and I'm certain that that might happen in the future. But this category of worker in the healthcare environment, as I stated previously, we are having an increased demand and a shortage in many areas, and many nurses and even physicians, especially in some of the rural isolated areas and in urban areas too, do not choose to work in certain facilities now because of the fear of violence in the workplace, and that is the reason for this bill.
So it's your contention, by increasing the penalties, the potential perpetrators of the crime will know the penalties, as the representative from West Tennessee stated, and they will know that in advance, and that in some measure that's going to reduce the crime of assault on those in the healthcare profession?
We believe that it will, because notices can be posted also that there is an increased penalty.
Is that a requirement in your bill?
It is not a requirement.
Do you have any statistical data that backs up your assertion that because we increase the penalty of an assault on a health care provider, that those assaults then subsequently decrease? Do you have any statistical data to support that contention?
I have some statistical data that says that it is believed that it will diminish the workplace violence.
Can you tell us what that data is, please?
I left that on my desk, but I can get it for you.
Well, I would like to have that data before we move any further, Madam Speaker. And
okay, here it is. This is in 2005, Nevada passed legislation elevating the penalty for violence against healthcare providers, and there was a 50% decrease in workplace violence in the healthcare sector. And this data comes from the Bureau of Labor Statistics 2010.
Can you give me the first part of that again? I couldn't hear you. I'm sorry.
Oh, I'm sorry. Can you hear me now, sir?
Madam Speaker. Thank you.
In 2005, Nevada passed legislation elevating the penalty for violence against healthcare providers. From 2005 to 2009, there was a 50% decrease in workplace violence in the healthcare sector. This is data reported by the Bureau of Labor Statistics in 2010.
Thank you very much. It's very important. Let me ask this last question. The bill that we have in front of us tonight, to what extent does it mirror the legislation that is referenced in that statistical report that you just gave us?
The legislation in Tennessee mirrors what deals with the public safety officers.
No, I understand that. You're citing a study from Nevada, is that right?
Yes.
Okay. My question is, to what extent, if any, does the Tennessee bill mirror the Nevada law that you're referencing?
Its intent, it mirrors it exactly.
It mirrors it exactly from what I can determine, because in Tennessee in 2010, the intent is to mirror that exactly.
Thank you very much.
Representative Hill.
Thank you, Madam Speaker. Will the sponsor yield?
Yield to me next time.
Okay. Yes.
Thank you.
Who's speaking?
A couple speakers ago stood up and said that, we don't need to be punching airline stewardesses, and we don't need to be punching pilots, and I would contend that we don't need to punch anyone, period. If under the current law that we have right now, if a health care provider is punched, is assaulted, what happens?
The person is arrested. The person may be indicted. It depends on the charges that are pressed against the individual. And I would like to yield to some of my colleagues who are here who could explain that a little more thoroughly than I.
Sure.
Representative Shipley, did you seek recognition?
Representative Hill, it simply is the same thing that would happen if anyone else is assaulted right now.
That's my point, because right now, if something happens to a health care provider and they are hurt or injured, which is awful, then they will already be charged with, or could possibly be charged with, assault or aggravated assault. In other words, we already have laws on the books, we already have laws in place that will charge these individuals appropriately for the crimes that they are alleged to commit. That's number one. Number two, with the amendment that's been adopted that says redefining health care provider, help me a little bit, sponsors. Does that include CNAs? Yes. Does it include podiatrists? Yes. Does it include chiropractors? Yes. Does it include respiratory therapists, physical therapists? So it just goes on and on and on. Ladies and gentlemen, I understand the intent of this legislation. I think the intent is good. However, I do not believe, as previous speakers have mentioned, that we need to be punching anyone. We don't need to be harming anyone. We don't need to be assaulting anyone. And we already have laws on the books to handle that. It's called assault. It's called aggravated assault. It's called assault with a deadly weapon. We can go on and on. Those are already on the books. And the folks that harm our health care providers should be prosecuted to the fullest extent of the law, as in the laws that are already on the books. Thank you, Madam Speaker.
Representative Kent Williams.
Thank you, Madam Speaker. Move previous question on the bill.
Previous question has been called for. Is there objection? Seeing none, we're voting on House Bill 306. Excuse me, Representative Parkinson, did you wish to make comment? Fine, okay. As amended, vote aye when the bell rings. Those opposed, vote no. Has every member voted? Does any member wish to change their vote? Take the vote, Mr. Clerk.
Aye, 64, nays 31, 2 present not voting.
House Bill 306, having received a constitutional majority, I hereby declare it passed. Without objection, the motion to reconsider is tabled.